Welcome. I'm your host for today, David Lapp. I'm a co-founder of Brave Angels and the director of the Working People's Project at Brave Angels. Welcome to We the People's Forum, a Brave Angels event where everyday Americans get time at the podium. So our question tonight is, should COVID vaccines be mandatory for healthcare workers? And our first speaker is Mary Galantino. She is a registered nurse certified in oncology and hospice and palliative care. And she also works for a university nursing program where she provides academic support to students. She has a Bachelor of Science in Nursing and a Master's in Nursing Education. And then our next speakers are going to be you all, we the people. After hearing from Mary, we'll open it up to discussion. And we especially during that time want to hear from other healthcare workers. And I should also add that we were looking for a healthcare worker who could be a first speaker from the pro-mandate side along with Mary. We were unable to do so, but I'm very confident that there's plenty of you in this forum, healthcare workers who are for mandates, and we would especially love to hear from you during the discussion as well. So we have 3 ground rules for tonight, and we've taken them from our Red Blue workshop. If you've done our Red Blue workshop, you recognize these. First is that we're here to understand others and to explain our views, not to convince anyone to change their mind. Secondly, let's each speak for ourselves and not try to speak for or represent any outside group. So we're just speaking for ourselves. And then otherwise, it's standard stuff that, we learned in kindergarten, taking turns and not interrupting others, listening to everyone, opening up space for quieter group members, being respectful, as in no eye rolling or loud sighs when someone is talking. In other words, bringing our best selves to a difficult conversation. So that's it. Those are our ground rules for the conversation tonight. So Mary, welcome to We the People's Forum. Very glad that you are here with us, and thanks for sharing your time and experience and perspective. So Mary, to just dive right into it, tell us what has it been like to be a nurse during the pandemic? And I know you're an oncology nurse, so just give us a sense of what that's been like, and maybe take us back to when the pandemic first began, how and when we first started hearing about COVID-19, how that the pandemic affected what you do as a nurse and how it has affected what you do as a nurse.
Sure. Yeah. Thank you so much for inviting me. I'm super excited to participate in this forum. Basically, to kind of go back in time, it didn't seem like that long ago, but it feels like a while, a long time ago. Basically COVID-19 was really just kind of like a blip at first. And especially where I work, we were actually not implementing nearly the protocols that we saw in other hospitals. Other hospitals around us were starting to mask every day. We're starting to wear N95s, shields. We weren't doing that at first. Actually, we were pretty behind the 8 ball, so to speak. And I think it's because our case numbers in the area that I work in just didn't really support what the other COVID numbers were saying in other areas of, especially Pennsylvania, let alone other states. So I think once the case numbers kind of started going up, when we started seeing those case numbers go up, our institution then started implementing certain policies. And, the biggest policy at first was for us as workers, right? Had to wear your N95 mask and then a surgical mask. And then you had to wear, and then a couple of weeks later, it had come out that you now had to wear not just eyewear, but really a shield, right? Because any mucous membrane that is in theory, not protected could become an area for COVID-19 to enter. And so that sort of happened for us as workers, and we're like, okay, got it. And we listened to, 2 weeks to flatten the curve, mitigating factors. And so our hospitals started limiting visitors. I will disclose from day, because I believe this, I never worked on a COVID unit. I never have worked on a COVID unit. I would get pulled to a COVID unit, but the area in which I work in, which is oncology, the institution that I work for tried very hard not to pull us to COVID areas. And the reason for that is because I work in an area with highly immunocompromised individuals. I work on an oncology unit. Not only are these people possibly getting chemotherapy on the unit every day, but they could also, um, you know, they could be having complications from the therapy. They could be dealing with side effects. And so we really wanted to kind of protect them as much as possible. So my unit essentially was an island. We kind of felt that way. Even a lot of us didn't go down to the cafeteria. A lot of us were bringing our food because we really felt like mitigating the spread of this could be done at least personally by kind of staying isolated on our own unit. Then what you started to hear is that, COVID-19 was coming and that there was going to be a specific unit that was going to be designated to treat it other than our ICUs. And you did start to see the burnout from staff. You started to hear from other staff members, what they were experiencing. And even though I didn't experience COVID, I did experience, though, the lockdown. I did experience, patients' families not being able to be at their bedside as they did pass away from things other than COVID.
Did that happen pretty much right away? So the visitor policy was something that was an immediate change that you saw.
Yeah, I would say maybe about 3 weeks into when our hospital started implementing the protocols, did you start to see limiting visitors. And at first it was you can only have one visitor, and then it got down to no visitors. And I think and I said to a lot of other people before, the ramifications of COVID-19 need to go beyond, unfortunately, the death rate. I don't think people quite understand, especially at the bedside, unless you've been at the bedside. I'm not just talking about the burnout from staff, but I'm talking about the impact that limiting visitors as well as, not allowing people to be at the bedside for someone that's dying, what that does to the grieving process, what that does to bereavement, what that does to those individuals that don't get that closure at the end of someone's life. And one of the reasons why I started sort of getting burnt out from it is because I had to hold up an iPad as someone said their goodbyes to their loved one. And it wasn't that our hospital wasn't allowing, because we would make certain exceptions, but it was the fact that people weren't traveling yet. People didn't want to come across the country yet. People were scared to get on an airplane. Airlines hadn't figured out what they were going to do yet. And so you didn't, you luckily, thank goodness for technology in a way, these people could say, quote unquote, goodbye to their loved one. But, it was very, very hard. And then what happened is we lifted those when the wave was over, and people got used to, having more than, one visitor now all day, or whatever. And now again, we see with this Omicron variant now, there's thoughts about us locking down again and no visitors again. And so it's one of the reasons why frontline staff are not only frustrated and they're not only burned out because of what we're dealing with, but the fact that we have been set to deal with helping people cope with dying, not in person. We're doing that virtually. And that is tough. You take that burden on then. It's one thing to have a family member sit at the bedside, hold their loved one's hand. It's another thing for you to be the one that has to sit at that bedside, hold that iPad as that loved one takes their last breath. That's more emotional toll than I think people really understand unless they sit there and are actually going through it. Whether that's a death of a COVID-19 patient or if it's just someone who at the end of their life is passing away from things other than COVID.
Yeah. So you, what are some of the stories and experiences that you're hearing from your nurse colleagues who are in the COVID units? What has been their experience like?
So I think, they're going to tell you too that they're emotionally drained, and the majority of them will tell you, they were going to work every single day in an unknown, right? When we talk about the first days of COVID, right, we went from just wearing a mask to then the shield to then you got to wear a gown, and then we went to disposable scrubs, and my colleagues in the ICU have told me time and time again, this was just so unknown. And every day you didn't know what you were walking into. And it wasn't just the fact that you could get COVID. It was also the fact that you didn't know what protocols you had to go through. We had people that were living in RVs and living in hotel rooms because they were afraid of taking this home to their loved ones.
Hmm.
Remember, initially, we believed that you could get COVID off of a surface, right?
Right.
I mean, you had people that literally were decontaminating their bodies because they were afraid of hugging their child. Later we learned, as everything, science evolves, and we learn more and more. And so we continue to learn that, you didn't have to leave your mail out in the sun in order to kill COVID, right? You couldn't get COVID from a surface anymore. It's a respiratory droplet. You have to inhale it. You have to attach it to your mucous membrane. So, that changed things a little bit. But it's the idea that every day we came in taking care of these patients, not knowing what was going to happen. And somebody said to me the other day, well, you did that because that's your job. Absolutely. It is our job. It's what we signed up to do. At the same time, you have to understand that when there are things, that maybe, for example, if there are other ideas out there, we're going to talk about the vaccine, but if there are other ideas out there outside of the vaccine to curb this pandemic, it's those frontline nurses that are trying to bring other modalities and other therapies to physicians' minds. It's almost like they're getting burnt out because we're not being listened to, because if you don't lockstep with what the majority of society and science is telling you to believe, or that you're supposed to believe, you're kind of considered a heretic now. And I find it interesting, and we always use the term, we were heroes last year, and if you don't believe in necessarily what's going on now, then now you're a zero. And I find it interesting that there is this dichotomy and there is this division, even among healthcare workers who have been on the front lines. And it's interesting, who do you listen to? Do you listen to the people on the front lines? Well, they're both on the front lines, and they both have a different opinion as to what's going on. But there is no denying the fact that COVID is real. There's no denying the fact that it is unfortunately killing people. It has killed people. There is no denying, unfortunately, that as much as we know about COVID, we don't know about COVID. Science is ever changing. Science needs to evolve, and so I hate when people say, oh, 6 months ago they told us this and that's what we did and now this doesn't work. It's not that it doesn't work, it's that we've learned.
Sure.
And,
Yeah.
I think that
Yeah,
that's
the
the
way
point that
science
we
works
need
is
to
we learn
remember.
from we learn over time through
Yes,
through experience and what the data is telling us and so forth.
correct.
So let's go to the vaccine mandates.
Mhm.
Fast forward to the vaccine mandates. So first of all, how did you get involved in the whole issue of vaccine mandates?
So, first and foremost, I was never a big proponent of the flu vaccine mandate. When I first started out in nursing and I was told I had to get a flu vaccine, anybody that knows me will tell you that I opposed it from day one. And they kept asking me, well, why do you oppose the flu vaccine mandate? And it's not that I oppose the vaccine. So I just want to state quickly, I'm not an anti-vaxxer, and I really hate that term. Because there are people out there that are against vaccines. It's not me. I've gotten every single vaccine. My parents immunized me. I got every single vaccine I've ever have supposed to receive. I'm not anti-vax. I am anti-mandate. And I think that there is a very, very different distinction. I don't like mandates because they sit on an ethical platform and it can be a predication for something else. I specifically don't like the idea of a mandate because in order to get away from the mandate, you have to be granted an exemption. Depending on what exemption you apply for, some states allow philosophical, some allow religious medical, some only allow one or the other. Either way, in order for you to be exempt from the mandate itself, you have to divulge information to your employer. That to me is a very, very slippery slope. It would be equivalent to me calling my employer right now and telling my employer every medication I'm on, every disease I've ever had. I don't feel at this point that a mandate is appropriate because we are starting to see that more and more exemptions, especially medical exemptions, are being denied, and your employer is learning a lot more about your medical issues than I think you want them to know. For instance, I have a friend of mine who was denied her medical exemption, and her employer requested a list of her current medications. Her current little list of medications are some meds that perhaps she doesn't want her employer knowing that she is on. She is on a medication for mood stabilization. She is on a medication for a chronic disease that, if her employer found out about it, could ostracize her from the healthcare community. So do you think that that is fair? So I'm against a mandate in the fact that in order to be exempt from the mandate, you have to be willing to relinquish your privacy. And I believe that your employer having that information is not a safe idea.
And so you had a kind of a pre-existing, even before the COVID vaccine became an issue, mandate became an issue, you had kind of a pre-existing concern about vaccine mandates in general, with a flu vaccine mandate. So then so practically, I guess, was this just a couple months ago, a couple weeks ago? When did you have
so
to
we
say,
kind of started our mission a couple of months ago. A group of us got together. It's a very, very small group of us. We got together kind of like, what can we do to fight this mandate? And interestingly enough, about 75% of the members of my group have had COVID, and they are frontline workers. They're in the ICU, they're in the OR, they're in the ER. Okay, they're not an isolated island like I was. So they themselves have gotten COVID. They've gotten COVID, have survived COVID, and now have natural immunity. And so what we really wanted to do is we wanted to fight the vaccine mandate, not just because we don't agree with the mandate, but we really wanted our organization to recognize natural immunity. And we feared that the reason why they were not is because they knew that later on down the line, there was going to be a mandate that would come out either federally or, which we now know it has, or CMS, Center for Medicare Services, was going to mandate, and therefore it would affect their reimbursement because they're beholden to the rules and the laws and the regulations of CMS. If that were the case, we understood that. But then why can't you recognize natural immunity? So when they say it's for society, when they say it's for you, and when they say it's for other people, don't buy that, because if you really bought that, then you would also buy into natural immunity. Because right now it seems that natural immunity is way more longer lasting than the vaccine is. We're learning that. Once again, science evolves. And we did not know that 6 months ago. We assumed that this vaccine would be a lot longer lasting than it really has. It turns out that based on new research coming out of Israel, coming out of Europe especially, that it seems to be that the vaccine efficacy is waning. Hence the reason why we need a booster. So that's really kind of how our mission started, is that we wanted to recognize natural immunity. And then on top of that, we didn't feel that it was right that if you did already have COVID, that you should be forced to get a vaccine. And that's kind of how our mission started. And
so this was with fellow nurses and healthcare workers from your hospital?
Yep. Our group started off about 275 of us. And as of yesterday, I can tell you right now that we are 685 strong. So interestingly enough, the movement is getting bigger. And I think the movement is getting bigger because people are starting to open up their eyes. Because I think the biggest thing that is causing hesitancy with the vaccine is not those that don't want the vaccine. It's actually the messaging coming out from the people that are pushing the vaccine. Because the harder that they're pushing, people are starting to wonder, why are you pushing so hard? And that's what we've said from day one of our mission. We're not against a vaccine. If you want to go get a vaccine, that's great. Good for you. You do what you feel you need to do. But we're against a mandate, because the fact that you have to be forced to decide to put something into your body or lose your job. That I understand it as a choice, and your choice comes with consequences. But when you're dangling a paycheck and money over someone, do you think they're going to make a rash decision, or do you think they're going to make one based on the fact that they're almost being coerced into doing something because they have to do it? And anytime I've learned historically that when you coerce someone into something, it usually does not benefit the person that is receiving said item or said product, so to
So
speak.
Mary, let me ask you, the mandate in your hospital, what is the mandate? And for instance, what is your situation now? I
Sure.
mean, are you still employed
I am
with
still
the
employed.
hospital?
Still employed. We have until January 4th. Originally, the mandate date had been pushed back, and then Joe Biden came out with his federal mandate, and CMS is making it January 4th. So our institution has kept it January 4th. If I do not get either, well, I'm past the point at which I can get the two-part dose. I'd have to get the J&J right now. I then have to wait 14 days, and then I am considered fully vaccinated if I get the J&J. Is at that time, if I am not fully vaccinated by January 4th and I do not have an exemption granted to me, it does not state I will be fired, but it says I will no longer be employed or retain employment at my institution.
Got it.
So, me personally, I was granted a religious exemption, 100%. I was granted a religious exemption. I wrote my religious exemption not based on, I did not have to have a religious authority sign for it. I based my religious exemption on the fact that I value life. I do not agree with the vaccine being tested and modified, and essentially worked on aborted fetal cells. I do believe wholeheartedly these are my sincerely religious beliefs and convictions, that it doesn't matter what good will come from that action. The sin itself has been created. And so I've learned all of my life to respect human life. I have been pro-life all of my life. Anybody that knows me knows that I value that. And those are the basis for my religious exemption. And even though I was granted one, does not mean that I have stopped the fight. And that I think is, something telling. So it's not that, I mean, I could sit back and just be like, okay, I'm done. I got my religious exemption. I have to be tested once a week and we're good to go. I'm continuing this fight because there are people that did not get their exemptions. There are people that are being denied their medical exemptions because our employer is asking for more detailed medical records and they do not want to submit to them. Once again, like I stated in the beginning, this ultimately becomes a concept of privacy. And how much are you willing to divulge to your employer? And should you divulge to your employer? Aside from medical, do I want my employer knowing my religious beliefs? Do I want my employer knowing my philosophical beliefs? There are some states that allow philosophical exemption. Are you philosophically opposed to the vaccine? Do I want my employer knowing that my philosophical leanings on the vaccine? I think it's a very, very dangerous territory because we have already seen in society that the vaxxed and the unvaxxed are being segregated, right? And so imagine your employer now knowing you have certain beliefs over some other certain beliefs. I just think it's a very, very slippery slope. Just like I can't wear a political statement on my chest at work, my employer now knows my religious beliefs. It it becomes
Mary,
dangerous.
let me ask you,
Mhm.
want to ask you about, I want to ask you this question before I get to that. I want to ask you something else. So one question that I've got coming down here, you can start thinking about is what are some concerns or reservations you have about your own position? Another way to put it is, are there any potential downsides you see with your position? But before,
Absolutely.
so I'll give you some time to think about that. But as you know, one of the common arguments that's made for vaccine mandate is that is looking at the data uh, about those, for instance, in ICU units or who are dying from COVID. And as you point out, there seems to be waning vaccine efficacy over time, but boosters apparently help that a lot. And even with the data that we have, like I saw, the Texas Department of State Health Services, for instance, I was looking at, they did an examination of data from January 15th to October 1st, and they found that more than 85% of COVID-linked deaths were to unvaccinated individuals. And in September, when the Delta variant was surging there, unvaccinated people were 20 times more likely to experience a COVID-associated death than unvaccinated people. So, but I grant your point that you need boosters to boost the efficacy of this and so forth. But what about that, those points of data showing that the vaccine does appear to be very effective at preventing death, if you're looking at vaccinated versus unvaccinated?
Sure, and you're absolutely correct, right? Is it going to prevent death? Yeah, the early data shows that it does reduce that, but once again, that is not a societal impact. I mean, you think that it might be, but at the end of the day, that's a decision that you should have to make, whether or not you're willing to take that risk. I give the example of my oncology patients. My oncology patients are given medications every single day as part of their therapy. They know that they could get a side effect that could, in theory, cause death, right? It could. I have seen it firsthand. But it's a decision that they make themselves, right? Now, someone will tell you, and some people have told you, okay, but the more people that are clogging up ICUs, you're going to start running out of, services. Ironically enough, I do believe that in a way, but mandating healthcare workers who, honestly, if they leave the bedside, it doesn't matter how many ICU admissions you have. If you don't have the staff to take care of them, then you're going to be in a bigger problem. And that's why I'm against the mandate. I'm not against the vaccine. It should be a personal choice. But when you mandate something and you have someone make that choice, there are people that I know that work at my institution that have already left because they've decided, you know what, I'm going to go do something else with my life. Or I don't need to work anymore. My husband can support me. Or my spouse can support me. I don't think people realize, if you look at New York, when they implemented the vaccine mandate among healthcare workers, there were units closing down. If you really care about providing adequate and safe services and healthcare, then why would you essentially cut staff out of the possibility, cut the people out that are going to treat these COVID patients who, regardless of the vaccine, are still being admitted to ICUs, who are still being ventilated, who are still being admitted to the hospital. When you cut out those people, you get like what you saw in New York last month, an entire labor and delivery unit closed. Okay? I had to transfer a patient 2 weeks ago to a higher level of care. I called and I said, okay, is the bed ready? The nurse told me, oh, I have the bed. I don't have any staff. And I said, what do you mean you don't have staff? He said, oh, I have 30 beds, but I have only enough staff to equip 24. So 6 beds were literally laying unoccupied. You want to know why? Because they don't have the staff to take care of them. Now,
So
is
for
that
you,
because
it's
of
partly
COVID?
a pragmatic issue of making sure that you have enough staff to operate.
Correct. And so if you're willing to make the decision to mandate your healthcare workers, you have to be willing to also live with the fact that if they leave, what are you going to do? I can tell you what most institutions are doing. They're hiring agency. Do you want to know why most of my colleagues, a good percentage of on my unit alone, we've lost 3 people to travel nursing in the last 2 weeks. They've left. They can make 3 times as much in another state at another hospital, right? Specifically, New York is where most of them have gone because those hospitals do not have enough staff because they implemented the vaccine mandate.
So Mary, let me and then we're gonna get the voices of
Sure.
those of others in the room, and as you begin to think about what you want to say or the question that you have for Mary, we want to particularly encourage other healthcare workers who are here to weigh in with your own perspective and experience. And at the beginning, especially, would love to hear from a pro-mandate healthcare worker or healthcare workers as well, so we can hear your perspective. But before we get there, let me go to the question that I teased, Mary. And this, by the way, this is a question that we have that's a part of the Braver Angels workshop. It's what are some concerns or reservations you have about your own view on your own position on this? Another way of saying it is, what are some potential downsides that you might see with your own position?
Okay, so what are the downsides to the fact that I'm against vaccine mandates?
Yes,
So
exactly.
trying to figure out the other person's point of view.
Yeah.
I think first and foremost, most people have a belief that because it has been touted, this is a pandemic of the unvaccinated. I really think that that is a logic that has to be dispelled, and is currently being dispelled every single day if you decide to look at the research. An article by The Lancet just came out a couple of days ago, actually, that stated that there is no equivocal difference between the vaccinated and the unvaccinated with transmission. So the belief that it is the unvaccinated that are causing this pandemic to continue, the data suggests otherwise. And if you
So
also
I
look
hear
at
you on the, I hear the
yeah,
point you're making, Mary, but how is that a potential downside to your position?
I think it's a potential downside because, if it does in fact show that healthcare workers are indeed spreading the virus to patients, that is a very big issue, especially an ethical and a moral issue, because as nurses, our first primary objective is to take care of our patients. We don't want to show any ill harm to our patients. And so if it is really the case that I am potentially going to spread this virus to a patient, then that is something that as a nurse would be going against my moral and ethical rights and responsibilities that I've decided to uphold in my position.
Okay. All right. Well, let's open this conversation up. Thank you, Mary, for sharing a bit of your experience and your perspective, and we'll continue to hear from you as well. So for the discussion here, as I said, if you're a healthcare worker, we especially want to encourage you to speak up. You have direct experience of this issue, and you almost certainly have something to say about it. So if that's you, I want to invite you to speak up. Before I get, and everyone else, is that you can either ask a question, or if you do make a comment, I want to invite you to consider making a comment from the standpoint of your own personal experience and how you've been affected by the COVID-19 pandemic and the vaccine mandates. And then if you're asking a question, one of the things that we do in our Brave Angels Red Blue workshop, and we have a period of there where we're able to ask each other questions. And what we say is, and this comes from my colleague Bill Doherty, who designed the Red Blue workshop, there's some elements of good questions of clarification or understanding that we talk about. And there's 5 of them that I want to mention and encourage you to think about as you're crafting a question for Mary. One is, so this is, think about this as things to consider in a good question. One, it's not a gotcha question. A second, it's something you want to learn something about someone else, something you're curious about, versus wanting the other person to learn from your question. It's a question that the other person can actually answer, and the question is straightforward and doesn't carry an assumption that the other person might dispute. So genuine questions of understanding, something that you really want to know, something you're curious about how Mary's experience and perspective on this. So again, comments and questions are welcomed. If you're commenting, please do so from, please share your personal experience on this. And for this first one here, yes, people are raising their hand, and that's exactly how we'll do it. There's a raise hand feature at the bottom of your screen. You can click on that. So now of the hands that I see raised, I would love to get us started here to hear from a pro-mandate healthcare worker. Are any of the hands that are raised, if you could just raise your physical hand, if you're a pro-mandate healthcare worker. Okay, Michelle, go for it. And take up about, we have just still a lot of time here. We have about 3 minutes per comment. So go ahead, Michelle.
Okay.
Oh, whoops, sorry. I accidentally muted you, Michelle. Go ahead and unmute yourself again. Go ahead.
Okay. I just want to thank Mary, and I just want to just say I am completely opposite of Mary on this position. So I just wanted to say that, and I'm going to try my very best, Mary, to be very respectful. And I worked in the ICU for 10 years in the MICU. So I'm not working now. I actually, this has affected me is I was doing home health care, and it's just me and my daughter. I don't have any family. So I had to quit working. So I've hemorrhaged money, and I am very grateful for the vaccines. And I'm very, I have a BSN, and I am very best practices. That's my orientation. I very much defer to the experts. That's kind of where I'm coming from. I agree with you, Mary, that this is a vaccine we don't know a lot about. I am suspicious that it did come out of a lab. It's so weird how it presents. And I understand your feelings. I think I understand your feelings about how weird this is. My best friend, who started with me in the ICU in 1988, hates flu shots, just like you. We had a patient get Guillain-Barré and die and from vaccines and things, and and she just won't do it. So I feel for you. I definitely, however, I'm very much suffered myself because I'm very nervous about this disease. And my feeling is that healthcare providers, unfortunately, have to comply with best practices. I feel that if you don't want to take the vaccine, if you feel like it's a threat to your health, you can vote with your feet and leave. Basically, that's how I would handle it, because we don't have anything more than our best guess. And we all have to work together as a team and follow the best we know out of respect. Now, if you don't feel safe taking that, I agree with you. My friend says, she had COVID, her husband had COVID, their father died from COVID. The family, he died because of this. The brother was exposed, etc. So they've gone through it. And they feel like, well, we have natural immunity, so why should I have to take this? Well, I would love to see more research done on natural immunity. But just like we know that boosters are needed for people who have the vaccine, how do we know that people who have natural immunity don't need boosters? See, I don't know why we haven't done more research on people who have natural immunity to see where their levels are of immunity, so that more research done so that we can help support people who are very vaccine phobic, so that they feel supported. I'd love to see more done along that. But in the meantime, I feel like we have to do the best we know how, and that means support those mandates. And you can go into some other area of nursing where you're not exposed to the public. In the meantime, just move you to something where you're not doing patient contact, because I feel like the public has a right, safety first. And we know that this disease, it's a weird disease and it kills people, and it's arbitrary. It tends to kill old people, but it can kill anybody. And
Michelle, take about 15 more seconds.
So, and that's where I'm coming from, in all due respect. And it breaks my heart that we have this tension between us. And that's how I would do it. More research on natural immunity.
Thank you, Michelle. Mary, feel free to just briefly say anything you want to say in response to that, or you can.
Michelle, thank you so much. Thank you so much for speaking out. Really, I definitely agree with you. We do need more information about natural immunity. And aside from the vaccine, we also need more information about other modalities and other therapies. Why are we not exploring other things? Why are we pinning all of our hopes and dreams and mitigation right now of this virus to a vaccine? Why are we not looking at other ideas? Why are we not looking at other countries that have very, very, very low COVID rates that, for instance, the west coast of Africa, very, very low COVID rates, and they routinely get anti-malarials? Are we failing to recognize other therapies? Why are we pinning our hopes, our dreams, and more boosters when there are other modalities out there? And it's sad, because when you look at people that try and think about other modalities, they're ostracized and they're silenced by the community. And I really feel for you. I feel for what COVID has done for you, your family, how you feel about it. I don't understand why we don't look more at natural immunity. But the only thing I can think of is because natural immunity doesn't make money. Natural immunity does not have a profit margin. 15
more seconds, Mary, and then we're going to go to the next.
Natural immunity does not profit anyone. Natural immunity does not put money in anybody's pockets. I'm not saying anybody in particular, but natural immunity has no winning to someone other than the individual, as well as herd immunity. You can't make money off of someone's natural ability to fight a virus. That's why I think there's no research being done on natural immunity, because there's nothing driving it.
And let's go now. Thank you, Michelle, for your
yes,
comment.
Thank you so much.
to another, is there another of the hands that are raised? There's another pro-mandate healthcare worker. Sandy, you're raising your hand. Go for it.
Yeah, I'm also a nurse, and I noticed that you're a CHPN, Mary. I have been, but I didn't renew it this last time because I'm too close to retiring. But I do work in hospice, and the place where I work, we are mandated to have the vaccines, but I had mine before the mandate. The things that I've read, the places where I differ with you, I agree it's a person's personal choice whether they want to risk getting sick, but I don't think they have the right to go out and make other people sick. And so the difference for me is what I've read, people who have had the vaccine, yes, can conceivably transmit it, but it doesn't live as long in my system because I've had the vaccine. So I'm less likely to give it to somebody else and less likely to give a severe case of it to somebody else. The things that I have read about the natural immunity are that it may last longer, but it's not as strong as what you get. They've tested, they are doing some research on it. And what they found is that the levels of antibodies in the people with natural immunity are not as high as they are in the people who've had the vaccines. So from that standpoint, I think the vaccines are a better bet. I love it if we find some other things like anti-malarial drugs, if there's something else that'll work. I hope we're looking at those things. But for right now, the vaccine is all we have to try to protect our patients and the rest of the public from this disease that is, and in fact, I do think it's a disease at this point, a disease of the unvaccinated, because that's, 90, 95% of the people who are in the hospital dying are people who are unvaccinated. So that piece just really, I don't want more people to die. I don't want more ICU nurses to get burnt out from having to deal with all these people dying, perhaps unnecessarily. If they'd had the vaccine, they might not be dying. So those are my thoughts on it.
All right, thank you, Sandy. And let's get some more voices in here. I'm sure, Mary, you have thoughts on to respond, but let's hear from some more people. Nancy, you have your hand up. Go ahead, Nancy.
I'm sorry, I was muted. I'm a nurse practitioner, and I wanted to talk a little bit about the historical perspective of vaccinations. I was born in 1949, which was in the middle of the polio pandemic, and cause unknown, lots of panic, lots of death, and lots of post-polio syndrome that we're still seeing. And because of that, and because there was a lot of children involved, there was a big push to find a vaccination. And back then, people lined up, not mandated, but there was so much fear and concern about their children that everybody got the vaccine. Then I was in home care, and AIDS became an issue. And again, we didn't know the cause, we didn't know the treatment. And Mary, I really related to your fear because when I had my first AIDS patient in their home, and I had to go in not knowing what to wear, what the treatment was going to be, if they were going to die. And I just put on everything I had, better to err on the safe side. And thank God there weren't issues with supply and demand about protective gear. I think with the flu vaccine, we should understand that, viruses change, viruses mutate. And every year when the vaccine is created, the virus comes from other places in the world that are going through the flu season so that they know which vaccines to give us when our time comes to have the flu. So the other thing historically, and Mary, you said your parents immunized you, and children still need to be vaccinated for measles, mumps, chickenpox. those are mandates that have kind of protected society. I have worked in clinics where, you know, the first mothers at an immunization clinic will be those people who have come from countries where those diseases are much more prevalent. They know the importance of vaccinating their children. There are places in the world, and this is off topic a little bit, but
And do wrap it up in about 10 more seconds, Nancy.
yes, thank you for keeping me on point. I wanted to thank Mary for bringing up the point about the fact that there is no money behind research in natural immunity. I think that's a big, big point to make.
All right, thank you, Nancy, for sharing your perspective and experience. Let me get one more health worker before we just go to anyone. Of the people whose hands are up, any anti or pro mandate or somewhere in between, healthcare worker, Fred?
Unmute, yeah. So I come to this, I finished medicine in 1970. I've been in practice till about 7 years ago as a nephrologist. And I understand the concerns of what it is that you have to share your personal history with your employer or your supervisor or anybody that's in charge of you, and that's a problem. But that's a problem that's created if you, as a person, decide that you don't want to go along with what you're asked to do. Now, as a physician, a nurse practitioner, whatever healthcare job you have, if you're in healthcare, your primary concern, your most important concern is that you will not affect the health of your patient. You will in no way at all adversely affect it. If you, by not taking the vaccine, put the life of your patient at risk, you are taking a risk that you are not entitled to have. Because as a healthcare worker, your dedication is, I will do no harm. That's what you're supposed to do. At one of the conferences that I attended, somebody in India said very wisely, where we will only be safe when everybody is safe. If there's one person out there that is not vaccinated, there's a problem. Many of you may know the history of Typhoid Mary. Typhoid Mary was a woman that had to be quarantined for life. She was locked up because she carried in her gallbladder the bacteria that caused typhoid fever. And as such, she caused, I think it's 7 or 8 cases of the patient that she took care of. We got plenty of examples to show that if you, as a healthcare worker, don't do what you're supposed to do, you may adversely affect your patient's outcome. If you smoke, you can't tell, you're not entitled to tell your patient not to smoke. End of story. If you weigh 300 pounds, you can't tell your patient to lose weight. There is no responsibility and reflection there. Now, I do want to look, just changing topic 1 second. It says, I'm going to read here from Medical News Today that's talking about Lancet. There's been some reports about people developing COVID-19 more than once. These numbers are too small to carry out good long-term studies. It is difficult to determine how long-term immunity confers SARS-CoV-2 infection lasts. So we really don't know. There's no money in it, yep. But I don't think that the reason why it's not being studied is a question of money. There may be a, dark motive behind there. I personally think that what we've seen here.
And take about 15 more seconds, Fred.
Okay, thank you. What we've seen is miraculous. And the way that this has changed is dramatic. And I think that all of us in medicine should be responsible and take the vaccine. Thank you.
All right, thank you, Fred. Mary, I know you want to get in on this. I want to call on one more person and then invite you to respond to what you've heard thus far, Mary. I'm told that Christopher Ward, I think you work in an ER, in the ER unit. So go ahead and speak up, Christopher, and tell us where you're coming from on this.
Yes, hello. So I work in an emergency department. I'm an emergency physician. have been for about the last decade. So I've kind of run through this whole thing and seen it firsthand. What I will say is people are definitely struggling from a healthcare standpoint. Have been struggling with both, as was described before, difficulty with PPE and protecting ourselves. And now we're struggling with staffing issues, which have been really detrimental both to healthcare workforce who are burning out, but also to our patients. Now, pretty universally, when I go into work, we are seeing people that are waiting for hospital beds because there aren't beds available. And as I mentioned before, oftentimes that is a staffing issue where a lot of people have chosen to leave the career. And I think a minority of that is from this vaccine issue. But we continue to see an overwhelming number of COVID patients day in and day out. And the extreme majority of them are unvaccinated. And it's really painful to see these experiences of individuals who have chosen not to vaccinate, who are coming in sick and not recognizing how hard it has really been, how hard an illness it is to survive. And then, of course, seeing the staff that are just exhausted from taking care of these patients while trying to manage other patients with other medical conditions and just not having the energy to do so. So I think we live in a society and in a time of science where we are so incredibly fortunate to have access to what has been proven to be a life-saving vaccine. And so along the lines, my biggest concern, I'm hesitant about the vaccine or mandates just because of anytime you force someone to do something, there's an inherent pushback at doing that. But I think ethically, there's a really good reason to do that. I know it was mentioned before, a concern that, well, I guess my biggest concern with not doing it is, as mentioned by the previous speaker, is that we as healthcare providers, our first duty is not to cause harm. And if we are, our workforce as a whole are young, healthy, and generally, if we're going to get sick with COVID, most of them we're going to do okay, thankfully, for this particular illness. A large majority are going to do okay, although there have been many deaths in the healthcare community as well. I'm very concerned personally about the potential for spreading illness to others. And I think that's one place where the vaccine is a wonderful thing for us that are exposed to this virus day in, day out. I'm seeing patients every single day, basically, that I'm working that have COVID. And thankfully, we have some PPE that is protective to some degree. But the last thing I would want to do is to expose my patients to an illness that might kill them. Because we are definitely seeing patients that don't have the immune system to protect themselves. Although there was, I was looking back at this reference to the Lancet article that was previously mentioned and recently published about unimmunized individuals, about immunized individuals still spreading the disease. The most recent one from Lancet was of about 400 individuals, 200 individuals, a very small study that seemed to indicate its conclusion is that it does actually decrease infection and accelerate viral clearance. So they actually are less likely to transmit sooner. Their conclusion, though, is that fully vaccinated people could still transmit the illness. But looking back in October, there was a much larger study published in the New England Journal of Medicine that had almost 200,000 individuals, and it showed substantial decrease in the transmission rate of immunized people within their households. That's immunized healthcare workers in households were far less likely to spread disease to their family members, be them immunized or not, if they were immunized, suggesting a very strong correlation that immunization does decrease transmission.
More seconds, Christopher.
Sure. So along those lines, I think we do have a reason to be cautious and protect our patients and everyone else that we're encountering with to immunize ourselves and reduce that transmission amongst the community, because I think that's the best way we have to stay safe. That's what universally all throughout human history, medicine's best invention has been the immunization. It has had the most influential mark on society and keeping us well. And I think this is going to be the same case.
All right. Thank you, Christopher, for sharing your experience and perspective. So Mary, you've absorbing all of this and you have some thoughts on it. By the way, one thing that's impressive of all the speakers thus far, Mary and everyone, is you're referencing where you're getting your material from. This study from Lancet and so forth. I always appreciate that, and that's helpful for me, so I can go back and look at the look at the information. So Mary, any thoughts in response to what you've heard thus far?
Yeah, so I definitely do agree. Like I said earlier on, I do agree that immunizations are effective. I've never denied that. It really does, though, come down to choice, because even though you say that immunizations are effective, is there a study out there saying that healthcare workers are getting patients sick? There's not a single study that has been done, even under flu mandation, that mandating the flu vaccine is protecting patients. There is not one. I have had librarians research this for me for months. They cannot find a single article that states that healthcare workers can make patients sick. So once again, it becomes once again a personal choice, like I said before. And I think, like I said, we're pinning our hopes and our dreams on this vaccine. And folks, we do not know its safety. It terrifies me that we have to live in a world of science. This vaccine hasn't even been out a year yet. We're going on a little over a year soon, and we don't know its long-term effects. I can tell you personally that there are lots of people that I know that have had untoward effects from this vaccine. And I'll be honest with you, it may be one of the reasons why I don't want it, but I'll state time and time again, why are we pinning our hopes and dreams to a vaccine? Why aren't we looking for other modalities? I will ask again, I know several people that have taken ivermectin. I know, right? It's the horse to warmer, right? Because that's what you've been programmed to believe. But ivermectin has been extremely effective medication before COVID-19 even occurred. It's been one of the safest medications, has very little side effects. And I can tell you there are people that are using it because they're not afraid to try it. I just got a phone call from someone whose family member avoided hospitalization because they were started on ivermectin. I can tell you I have patients that were snuck ivermectin while they were in the ICU and 6 days later walked out of the hospital. So I will ask you, why are we pinning our hopes and dreams to a vaccine? Why
Mary,
are
take
we
about
doing
15 more
this?
seconds and then we'll go on to further
That's the
comments.
whole point. This mandate is not only about not wanting to put that into my body, but it's hopefully getting to open up the eyes of other people to say, hey, listen, why are we getting such push? Why is there such a push for this vaccine? But there's not a push out there to look at natural immunity, to look at things like hydroxychloroquine, to look at things like ivermectin. Because guess what? The physicians that try to prescribe that stuff are being reported to the state medical board. So they're not even willing to give it a shot for fear they're going to lose their licenses.
Mary,
And that's
let's wrap it up now and then we'll hear from other people.
and that's one of the things that I think we need to think about. Why are we looking at other modalities? Why is this just this vaccine?
Mm-hmm. All right. So I'm just going to go down the line here. I'm just going in order in my screen. And Randy Lawrence, you are up. So Randy, do you have a question or a comment?
It's kind of a combination of a question and a comment. Mary, I appreciate what you said about not being opposed to the vaccine per se, but being opposed to the mandate. I want to point out that the vaccine was available to us in this country approximately in January. And I'm not sure when the mandates came, but it was several months later. So people did have the opportunity to voluntarily take the vaccine. I'm really puzzled, Mary. You work with cancer patients. You work with vulnerable people, like you said. I mean, your stories were very compelling. I just can't understand why anybody who works with such a vulnerable population or any patients would not want to do everything they could to protect those patients. You know, I could understand people who don't have any patient contact, who work in a janitorial perspective, perhaps other kinds of jobs. I understand that could be questionable, but for me, I just can't understand why anybody who is in healthcare, who has direct patient contact, would not want to do everything they could to protect those patients.
Yeah,
and
so I think your question
is our best option.
So I think your question is clear, and I hear curiosity in her voice. So Mary, help her understand, and those like her understand, where you're coming from on that.
So once again, the vaccine mandate at my institution was for every single employee. This was also employees that do their work from home. People that code, people that do not have any patient interaction, have never had patient interaction, are only coders at home, are required to get the vaccine mandate. Okay? That doesn't make sense to me. It does make sense to me on some level. Once again, you say you're exposed to patients. Yes. And once again, I will say to you, I want to see the research stating that an infected healthcare worker has given COVID to a patient. I want to see it. It's not out there. At least that I have been able to find. If you can find it for me, I will look. But the bigger issue that you have to ask yourself is that, do you think that the mandate is right in general? Because if the healthcare mandate goes through, it is going to be a mandate, and it's going to become the precursor for every industry. That means the guy who's making batteries or the guy who's putting pegs in a hole is going to require to get a vaccine. Why? That hole or peg going to get sick? No. Healthcare is the precursor to what is going to happen in this country if we allow vaccine mandates. We are the guinea pigs, folks. I hate to tell you, we are the test case. And if this happens, and if it is successful, other employers are going to follow suit. And then where does your argument hold? Where does the guy who sweeps up, urine in the ED, or not even in the ER, but in at a Texaco, is a janitor? Who is he protecting? Himself? That'd be the only person he's taking that vaccine for. It's not for society. Because I really do believe, unbeknownst to what you're seeing in the research.
Mary, take about 15 more seconds, and then we'll go on to the next one.
I'm telling you that people in the ICU are fully vaccinated. I don't know if they are where you work. I don't know if you're just looking at your numbers. But if you look at the people who actually work on the front line and can tell me the numbers, they are consistent with the fact that they are vaccinated. That's the bottom line. And so once again, I will protect my patients at all costs. At the same time, though, how is me not being vaccinated danger to them right now? Because if I'm sick,
I think we understand. I think you've made your point clearly, Mary.
Yeah.
Thank you for sharing your point.
Sure.
I want to go to, there's lots of hands up, lots of people are want to weigh in on the conversation. Let's go to Eileen. Eileen, go ahead and unmute yourself. And do you have a comment or a question?
I just unmuted and okay.
Yes, we can hear you.
I have a question. Mary, I guess I'm with everyone else saying that I do appreciate your position and the way that you're explaining it. I never had it explained that way to me, so I do appreciate that very much. Someone else here had made the comment that all we have is our best guess. And because of that, things have to keep changing. I know sometimes they blame Dr. Fauci or some other people because he'll say something and then he'll say something different maybe a month later. But it's because we haven't gone through this pandemic, another pandemic, for so long that we're starting over so many times. And all we can do is all we can do, and all we can know is what we know at the moment. So my question is, if healthcare workers are not supposed to do harm if they can help it, because this is a pandemic and not just something that's much less critical, why should there not be a mandate? Because this is a situation that is so different from anything else that, in my opinion, people that can have as many people as possible that can have the vaccine, we can stop it faster, possibly, from being all over the world. And if we don't have something to keep us from dying, it will keep going and it will keep
And then, so
manufacturing.
reiterate your question again, Eileen? Because there's a clear question there. So say that again.
Because this is a pandemic, why isn't it right to have the mandate and enforce it? Because this is a worldwide problem,
Okay.
and we're talking
Got
about survival of humanity here.
Okay.
It's not just, do you know what I'm trying to say?
So, and because we
Okay.
have so many hands up, Mary, let's keep it to about 1 minute so we can try to get as many people in before we have to go. So go ahead, Mary, 1 minute.
Yeah, that's a great question, Eileen. Thank you. I think you're absolutely correct, right? We are in a pandemic. However, why I'm against the mandate is because what the mandate could mean. So right now, people thought 2 shots done. Oh, now there's a booster. Oh, now we're talking about an Omicron variant. Oh, now we're going to need another booster. Oh, we're going to need another booster. When is it going to stop? My fear is I don't think it'll ever stop. COVID is here to stay. I don't think you're going to quash it. I think it's going to be like the flu. And so I think we're going to have to learn to live with COVID. Unfortunately, but once again, the mandate changes. The reason why I'm against the mandate is because the definition of vaccinated is going to change. You might have agreed to the 2 shot, but do you want a 3rd? Do you want a 4th? Do you want a 5th? This Omicron variant that's coming out, they're working on a booster now. Do I have to get that one now? So once again,
Take about
like
10 more seconds, Mary, on this.
like I said before, the mandate is a predication on what could happen in the future. It's not just about now. It's about setting the foundation and setting a predication for something that I don't think we could even imagine in the next 5 years, 10 years.
All right, thank you. Let's go to Chip Treen, who has a very serene background setting on his Zoom background.
I do. I wish I felt as serene as my background is.
Chip, do you have a comment or a question?
I have more of several comments, and I don't quite know where to start. But
Great.
Mary,
and if you could, Chip, just a reminder, try to bring in your own personal experience, how you've been personally affected by this.
So my personal experience is I was in a clinical trial, or I am in a clinical trial for the Johnson & Johnson vaccine. I really wanted to get the vaccine. I really didn't want to get COVID. And I really didn't want to pass it around. And the earliest way I could figure out to get it was to get in a clinical trial. And so I got in it, and it turns out I actually got the vaccine, and then I got it boosted a few weeks ago. And I haven't gotten sick so far as I'm concerned. It's working just fine. I have a couple concerns about, well, I appreciate some of what Mary said. I hear this argument, the slippery slope argument. It really bothers me because everything is a slippery slope. It just is. How many of us, and the other part of the slippery slope argument is nothing is 100%. We can't do anything and be 100% sure of the outcome. So you can argue that you could survive a car accident if you didn't wear a seatbelt. But almost nobody does that anymore because the odds are not in your favor, even though 1 or 2 people out of 1,000 survived because they got thrown out of the car and didn't get squashed in it. But most of the people died. So the same thing with airbags. All this stuff, these mandates that we have now has saved tons and tons of lives. So the idea that the government's just going to come and take us away and take all our privacy away, it's saving lives all the time. And I guess I don't get the fear. We're the government. We get to decide where the limits are. So in terms of healthcare workers, I'm terrified to go to a health place if they're not vaccinated. Now, maybe there's no documented cases, but your healthcare workers can take it home and get your mother sick, your brother sick, and your relatives and your neighbors and everybody else. Just like the janitor who doesn't have direct contact goes home and passes it to his wife, who is in turn working in a school, and then all of a sudden the school has it. So I guess I'm really frustrated with that kind of argument because it does pass. The virus doesn't care about your religion or your ethics. It just goes wherever it wants. So I guess it's kind of hard to hear healthcare workers say that they shouldn't get vaccinated or that they shouldn't be forced to do that. I do appreciate there's some medical conditions where they probably can't get vaccinated. There's a very few rare cases like that. And I get it's kind of creepy to have the government force you to do something. Nonetheless, we don't have Measles is hardly anymore. Smallpox is gone. Polio is mostly gone, and it's all because of the vaccines. And then another comment she mentioned is that we're not looking at anything else. And I'd say
Take about 10 more seconds, Chip.
okay, I'd say there's lots of other alternatives. Both Pfizer and Moderna have gotten other drugs that they're working on. So I think we're trying to do everything that we can. And I just wish more people would get vaccinated so we can get this dumb pandemic over with and back to our normal lives.
All right, thank you, Chip, for sharing your perspective. So
Okay.
in order to try to get as many people here into the conversation as possible, I'm going to ask any comments. Let's keep it to a minute from here on out. And Yale Finer, I hope I'm saying your first name right. You had your hand raised at the very beginning, so I want to go to you next. Yale, and then Richard, and then Bob. Go ahead, Yale.
Hi. I want to offer a perspective. I don't see myself.
Yes, we can
I
see
wanna-
and hear you.
You can see. It's a kind of a question between personal freedom and everybody freedom. Like, what is more important, my own health or other people's health? Minority versus majority. And in some cases, we say, let's put pipeline in indigenous territories. There are so few, and the pipeline give electricity to so many people. But in some cases, we say the minority is more, the majority is more important, or the minority is more important. So it's kind of, we need to kind of look at ourselves and kind of see if we are persistent in that. The other issue that come up is the trust issue. Some people trust science like blindly, but some people say this is a new science, this is something else. So how much we trust something new and how much we give a chance to people that are afraid of new things. So some of us like will buy the new phone, we'll buy the new computer, we buy anything that is new. So we can kind of see in our lives things that are resonate and not just so much focus on the specific.
Take about 10 more seconds, Yale.
Yeah, so I'm thinking like if we can take this conversation a little bit broader, like a little bit above the specific details, it will give us a little bit more air and maybe more ideas to come about. Trusting experts, trusting the motivations of the people running the things, trusting the media. Those all things is about trust and personal health versus majority health. And I think this is more kind of broad conversation than just the specifics of the vaccine or not vaccine.
All right, thank you for your comment. Richard, and then Bob. Go ahead, Richard.
I wanted to bring up a different perspective that hasn't been mentioned here. In fact, it's never mentioned in the media, and it bothers me a lot. I've read a lot of stories about children who have lost their father or lost their mother, lost their brother, lost their uncle, lost their grandfather, who they dearly loved, etc., all to COVID. And what we have here, if you look at the numbers, we have about 800,000 Americans that have died, but we have at least that many COVID orphans among children who have lost a parent. Some children, there was a family of 5 kids and they lost both parents because both of their parents refused to get vaccinated. And to me, it's just as selfish can be for somebody to not get vaccinated. I don't care if they're a doctor. I don't care if they're a nurse. I don't care if they're a president. And I sure don't care if they're Donald Trump. Everybody should be required to get vaccinated in this country. Everybody. And that's where Germany's moving to, by the way. They're basically going to require everybody.
And take about 10 more seconds, Richard.
One more point. As far as natural immunity, there's a whole lot of information coming out of South Africa that this new variant, natural immunity, does not work. In other words, people are getting re-COVID and over and over again with this new variant. That's what doctors are saying. And I have no reason to dispute this. These are doctors who are working in Africa.
All right, we're going to leave it there, Richard.
I don't buy your argument about natural immunity at all. It just isn't true.
All right. Thank you for sharing your perspective, Richard.
Yeah.
Let's go to Bob and then Pam. Go ahead, Bob.
Hi, yes, I have comments. So first of all, the problem I have with natural immunity is in order to get it, you have to get COVID and risk both death and long-term effects. So there are some countries that have had different kinds of vaccines than we have now. An inactivated virus vaccine is used in both China and in Russia. And that would give you the same kind of immunity that you would get from having had COVID without the risks that are involved. So why we aren't doing that isn't clear to me. In addition, we are working on other vaccines now. And some of those are, in addition to, I'm not sure about the inactivated virus vaccines, but some of them add additional proteins because everything is based on one spike protein, and that spike protein is what we're seeing mutate. So when you add additional proteins into it, you manage to get better immunity than we get from the current vaccine. So because we're seeing the spike protein mutate so much, we should be getting those better vaccines. Where they are, I don't know, because in March we said that there would be 8 new vaccines being proposed by November, and we haven't seen those. As far as I know, none of them, a couple of them have dropped out because they weren't good enough. As far as the safety of our current vaccine,
Bob, we're going to have to leave it there. Hey, Bob,
Okay,
we're going to have
great.
to leave it there. Thank you so much
Okay.
for sharing your perspective.
Thanks.
I want to go to Pam and then Fred, I know you have your hand up. I want to go to people who haven't had a chance to speak yet. So hopefully Pam, Jerry, Lynn, go ahead, Pam. Go ahead and unmute yourself, Pam.
Okay.
There you go.
The first thing I want to say to Mary is, Mary, take a look at me, see my face, and listen to what I have to say to you. My husband was.
Pam, I'm sorry,
Yes.
Pam. I would invite you to just, please, we're assuming that we're listening to each other. So let's just
Yes.
assume that Mary is listening with respect to you.
Okay. And Mary had said she doesn't know of any patient who's been infected with COVID from a healthcare provider. And I am asking her to look at me because I want you to know my husband was in a rehabilitation facility recovering from surgery. He was infected with COVID by one of the healthcare workers who was not vaccinated, and he died. He died by someone like you who would not get vaccinated. I can go on, but how many examples like my story do you need to hear? You talked about why the messaging you think is becoming
Pam,
so
take about
oppressive.
10 more seconds.
And the thing that I want to say, David, is that I'm prepared to finish in 10 seconds, but you've given Mary such an inordinate forum and so much time to speak, and others are being cut off. And we're hearing a perspective from Mary where she is repeating the same points. And I find that not valuable and not helpful.
I hear you. And Pam, I'm happy to talk with you offline about our format here and so forth. And of course, our condolences to you, Pam. I'm sorry about your experience. Thank you for sharing your experience and your perspective, where our hearts go out to you. Thank you. Jerry, and then Lynn, and then Tim. Go ahead, Jerry. You're muted, Jerry.
I got the vaccine when it first came out, not thinking a whole lot about it, but trusting what was being said publicly. And I have since come to the conclusion that we have been not just benignly, but deliberately misled. But I just want to do a little bit of reality checking on a couple of things. Number one, this disease, the mortality, overall mortality rate for this disease, if you are healthy and under 60, is considerably under 1%. There are many, many things in all of our lives that have just as much a likelihood of killing us. And I don't understand how the cost-benefit ratio of COVID is so much out of whack with other things. More adolescents, many more adolescents die of suicide than COVID. And there's a serious suggestion that the isolation has been a major part of the recent uptick in that. The other thing is on this issue of healthcare workers carrying the infection. I'm
Just
not
take
a
about
healthcare
15 more
worker.
seconds, Jerry.
I work with a lot of nurses they complained bitterly that they were not being given the protective equipment to protect themselves and to protect their patients. A disproportionate number of nurses have died. The reality of that is that the hospital administrations, which are now so urgently pushing vaccines, continue to fail to provide the appropriate equipment, including likely to the caregiver who took care of Pam's husband, unfortunately. And
Okay.
that is
We're gonna
the
have to leave it there, Jerry.
Thank you.
Thank you. And then Lynn and then Tim, you'll have the last people we call on. So Lynn, take up to a minute.
Hi, I'm a medical student, also fully vaccinated. I guess my question for the physicians and healthcare workers who've spoken about this is going back to Mary's original point. I think what I'm hearing is she was arguing for natural immunity to also be recognized in addition to vaccination. The latest I read was in Italy. They're doing that for their workers. Natural immunity is recognized. So I guess my question is, if we're operating on best guess, where would Italy's best guess be in relation to US's best guess right now?
So let's leave that question for us to ponder. We won't have time to answer it here, but very good question. Thank you for that, Lynn. Tim, you've got the last word here. Go for it.
Thanks, everyone. And yeah, Mary, thank you for doing this. And thanks, everyone, for great points. I think my question is, I guess, quick background. Vaccinated, didn't have any hesitation. However, I do have a bit of a libertarian bent. So, Mary, some of your arguments resonate with me in some way. However, where I think I have a hard time seeing where you're coming from is the fact that you work in a cancer ward, and obviously those patients are very vulnerable. So on a couple of different occasions, you've mentioned that if there were studies showing transmission from a healthcare worker to a patient, that might change your thinking. And I guess my question is, there are tons of studies showing transmission is higher amongst unvaccinated people. So I guess I'm just struggling to connect why we need to pick physicians versus nurses versus cops or factory workers or whatever.
That's a great point. The point that I would answer to that is the fact that as a healthcare worker, I wear proper PPE. I wash my hands. I use universal precautions. I'm not going to be the person in the grocery store that collects your money and then sneezes on their hand and gives you back the money. I don't do that. As long as I follow universal precautions, I wear my N95 mask and I wear my shield, and I'm protected. I'm protecting you. That is the point that I've been trying to make, is the fact that as a healthcare worker, I know how to protect myself, as well as the fact I know how to protect other people. Other people out in society don't know how to necessarily protect themselves correctly. They were wearing gloves in grocery stores. That's absolutely disgusting. That is not going to protect anybody. I know how to properly wear PPE if it's given to me, and that's what I'll do. And even though I have a religious exemption, I'm still required to wear a mask. I will still wear my N95. And if I am in a situation where I am in with a patient, I will wear my eye shield. That's what I will do. And I'm doing that to not only protect the patient, but I'm also doing that to protect me, because that patient could give me COVID. So, it's not just me giving it to the patient. It's the fact that that patient is just as likely to give it to me as well. Because believe it or not, some of my oncology patients are not vaxxed. They choose not to get vaccinated for whatever reason. And I don't ostracize them for that. That is their choice. So they could give me COVID as much as I could give them COVID. So the only difference is I'm the one that's wearing my PPE. I know how to properly don it. I know how to properly put it on and take it off correctly. I know what to do in order to mitigate the possible spread, and I will continue to do that. And the sad part is, despite vaccination, we should still be doing that, because even if you're vaccinated, you can still get COVID. So that's the other thing. I think vaccines have made people very complacent. They're not washing their hands as much. They're not wearing their mask. I have a coworker that refuses to wear an N95 mask even when she's testing somebody for COVID. That, in my opinion, is reckless. I'm unvaccinated. I've never not shared that with people. But when I go to swab somebody for COVID, because occasionally I have to do it, I'll be honest with you, I wear my PPE. I literally see people that are fully vaccinated. I saw the doctor
And
yesterday,
Mary, wrap it
fully
up in about
vaccinated.
15 seconds. We'll need to wrap
I saw
it
the
up here.
doctor yesterday, fully vaccinated. Go into a COVID positive patient room with a surgical mask. Really? Vaccinated. Okay, that's fine. But you can still give COVID to someone else if you're not wearing your proper PPE. And I think that's the whole point of this. You have to be willing to submit to whatever is the consequence, so to speak, of not deciding to get the vaccine. And I really, my heart goes out to Pam and the loss of her husband. I want to say that. And I'm really sorry for your loss. I truly, truly am. That comes from a very heartfelt place. But at the same time, you know, we can't just, like Jerry said, you know, for those that are healthy, this, you know, we have to see that there are other things that are causing the demise of individuals in the society. And COVID is not one, they're one of them, but there are a lot of other things, which is why I said from before, you know, it should be a choice, but there are other things out there that we can do aside from the vaccine. And the
And
fact
Mary,
that,
you have to have your last word right here. So to wrap it up right here.
yeah, once again, it's about choice and it's about privacy and it's about not being forced to put something into your body that we don't quite know what it will do.
All right. And we will leave it there. Thank you, everyone, for contributing to that informative, heartfelt, strong, difficult conversation. Thank you for that. I want to share, Apple Muncie has shared in the chat, and Apple, you can share again, feedback form to this We the People's Forum. Share your feedback to how you thought this went and give us ideas for other topics for future We the People's Forums. We're all about everyday Americans, hearing from everyday Americans on the issues of the day here. So give us your feedback. On Braver Angels, and if you're new to Braver Angels, I want to invite you to consider becoming a member. Jerry Silberman is a Braver Angels member. Jerry, tell us why you became a member and why you'd encourage others to do that.
Well, I became a member because I was very, very distraught, you know, last year at the way that politics in this country had become so polarized. And I work for a union of nurses, about 8,000 of them in Pennsylvania. And, you know, they come from every political position that you can imagine. A very substantial minority would agree with Mary on the position of the mandate, but they all work together and they all have to be able to talk to each other and work together, and making sure that those skills don't get lost was what drew me to Braver Angels.
All right, so if you believe in this project of trying to bridge the partisan divide, trying to find common ground, clarifying differences, and building relationships with each other, we invite you to join us, braverangels.org. So I want to, again, to close this out, I want to voice my appreciation and gratitude to everyone who has spoken here, to Mary for setting the table for this conversation. It takes a lot of vulnerability and bravery to share your perspective. Everyone who has, has responded to Mary, with whether you agreed or not, sometimes very sharply. I appreciate your sharing honestly where you're coming from on this issue. And so I want to express my own gratitude and appreciation to you all for this We the People's Forum. And this is one of the most difficult issues, and one of the most difficult public debates in our country right now. And so, can we continue to find each other as citizens on this and on other important issues? So that's it for tonight, folks. Thank you for joining, and we look forward to seeing you at the next We the People's Forum. All right, have a good night, everyone. Take care.
Good night.
Thanks, everyone. Wonderful conversation. Good night.
Good night.
Night, y'all.
Bye bye. I didn't